Morning, everyone. We're going to give a few minutes just for everyone to be able to join. Please do type into the chat box your name and where you're from. Also, if you'd like to share, what your role is and your sort of focus. If you're an evaluator, nutrition expert, if you're education expert, that would be great, or practitioner. Please do put that into the chat box. Bridge will also be sharing a link in the chat box just now for everyone to click on for a Google form or a register. So just look out for that. Thank you. Good morning, everybody, and welcome to this Bridge. This is a joint community of practice between the monitoring and evaluation sector and the ECD sector. So really nice to have everyone on board today. Just to say, firstly, please do put your name in the chat box and where you're from. And if you'd like to share, if you're an evaluator, if you're a project coordinator, if you're a nutrition, part of a nutrition project or education project, that would be great. Bridge have also put in the link to the register, so please do click on that and it'll take you through to the register. It's on a Google form. Let's just give it another minute. We're expecting quite a lot of people, so let's give it another minute just for everyone to join. And two things. One is that this meeting is being recorded, and secondly, that it is going live on Facebook as a live stream, just really to be able to increase the number of people who are able to participate in it. So welcome to everyone. Let's give it another minute. Okay, let's kick off. So welcome to everyone to this joint monitoring and evaluation CoP between education, ECD sector and monitoring and evaluation. And the topic we're going to be exploring today is around nutrition. We've got a really nice program lined up, and huge thank you to the speakers who've come on board to share their experience in evaluating nutrition as part, well, maybe not, but part of education. And that's really something we're going to be exploring as we go forward this morning. Just a reminder that this is a live stream on Facebook. It's also on the Zoom and it's being recorded. Please, if anyone would like to make some comments, give some input, share any resources, please use the chat box. We really use that a lot to look at the, and I keep monitoring it in terms of questions. We're hoping that people will be able to share relevant resources, whether it's evaluations, whether it's tools, whether it's nutrition, resources, please do put that in the chat boxes as well. Usually people do have their screens off just to help with the bandwidth, except for the speakers. We also will be opening it up for a reflective session later on. And in that, please do put your hand up if you would like to contribute in terms of actually speaking and sharing something to the full group. At the same time, please do put things in the chat box as well. We're hoping to make it interactive. As a community of practice, of course, it is really trying to network, to engage, to learn from each other, to share, to build our understanding, and particularly of the topic of looking at nutrition within our education programs, and how we monitor and evaluate that. What is really nice is that last week, I'm sure most of you were aware, was South Africa's National Nutrition Week. So this also ties in with with the theme and with what there's been a lot in social media and media regarding that. So we're really looking forward to this session. In terms of sort of kicking us off, we're going to have Thandeka Ransi, who is from Bridge, and she's going to sort of really set the scene. Please also have your phones handy or your computers, because we're going to be using Mentimeter. I'm sure most of you are familiar with that. We're then going to move on to look at evaluation of a national school nutrition program, and we're really pleased to have colleagues from the Department of Basic Education joining us for that. We then will have a very short body break. Please don't leave. Please please stay on. But we'll have a break at that point. And then we will be looking at, oh, sorry, I've got them the wrong way around. Well, the first presentation is actually going to be on ECD nutrition programs, and really to help us start the conversation of monitoring and evaluation. And we've got some colleagues talking about that. Then there'll be the break, then there'll be the DBE presentation. And after that, a facilitated reflective activity. So I think, just the one other thing I wanted to say was a big thank you to Benta, who has always coordinated these monitoring and evaluation CoPs. She has moved on from Bridge, but a huge thank you to all that she has done. And a huge thank you also to Thandeka and the team at Bridge for continuing to really drive these monitoring and evaluation CoPs. So on that note, Thandeka, I'm going to hand over to you. Just a reminder to everyone to please continue putting your names in the chat box as you come, and Bridge will repost the link as well for people who've just come in for the register. Thandeka, over to you. Thank you.
Thank you, Maggie. I hope I'm audible. Colleagues, I'll just be opening up the meeting and just providing context into why we are here today. I'm just going to kick off talking a little bit about the role of nutrition. So we all know that nutrition plays a vital role in the holistic development of children, and when done right, can contribute immensely to their well-being in the later stages of life. According to the South African Demographic and Health Survey of 2016, South Africa has one of the lowest rates of exclusive breastfeeding in the entire continent. We also have very high levels of growth stunting in children, which stems from inadequate nutrition practices. The first 1,000 days is a critical period where the foundation for optimal development is laid, and the right care and nutrition are a major contributing factor to this foundation. It is for this reason that the Bridge ECD CoP took a keen interest on the issue of nutrition. In addition, there's currently no solid nutrition strategy for children 5 years and under, even though this is an imperative for the national integrated ECD policy. The Child Gauge 2020 publication also reported that although ECD programs provide a source of nutrition to many children, the government subsidy only reaches about 10% of children in ECD programs, whereas the National School Nutrition Program reaches about 77% of public school children. Through the ECD CoPs that have focused on nutrition, we have heard reports that the diet children in many ECD programs consume is not balanced. Due to budget constraints and at times lack of knowledge, caregivers and ECD practitioners tend to provide starch-heavy meals as well as processed and unhealthy snacks. Health experts were raising a question around the monitoring and evaluation practices of nutrition in ECD programs. Hence, we are here today confronting the topic, monitoring and evaluation of nutrition programs in ECD and foundation phase. Through this CoP, we aim to focus on the practicalities of monitoring nutrition programs and demystifying evaluation methodologies in relation to nutrition. The knowledge and innovations shared will hopefully help us to improve practice in the nutrition and education space. Okay, so we will now move on to a quiz that will orientate us and just shift our minds to the topic at hand. We will be doing this through Mentimeter. Jade, can you please share the Mentimeter link so that we can all log on to Mentimeter? Thank you, Jade. Sorry, let me just minimize my screen. Okay, so the Mentimeter is asking 3 questions really. And that is, why is the issue of nutrition important in learning and development? And the second question is, what are the 3 most important terms in the nutrition field for your work? And the third question is, from an evaluation perspective, what do you think would be the main indicator to track the progress and success of a nutrition program? Will you please click on the link so you can access the Mentimeter question? We're going to give you a couple of minutes just to think about the questions and to respond to them. And in terms of accessing the Mentimeter, I think you'll just have to click onto the link and you'll go straight into the Mentimeter questions.
If not, just have a look at the top of the screen and go to www.menti.com and then use the code when it asks you for the code, the 86378932, and you'll be able to get into it. So looking at these responses, we can definitely see that there's a very strong link between learning and development around poor nutrition leading to poor growth, around concentration, development, not being able to learn on empty stomachs, the importance of healthy eating and living in terms of holistic development. I think there's very clearly, I think the group does understand that there is a link between these nutrition and education and learning. Okay, do you want to move on to the second question then? Just to also remind everyone that the input that we're getting from everyone will go into the highlights for this meeting and then will be shared as well. Okay, so Tandeka's second question, what are the 3 most important terms in the nutrition field for your work? And just to remind you that we did circulate a handy reference list of terms in terms of nutrition, because for a lot of us evaluators and education, people in education, this can be quite a daunting field when you do hear about all these different terms that come up. So there might be ones that are on the list, but there might also be other terms that you feel are really important in terms of your work. So what's coming up quite a lot is malnutrition, hunger, health, mentoring, funding is coming up, breastfeeding, stunting, need for balanced meals, need for around vitamin deficiency, poverty, diversity. Let's keep them coming through. Oh, interesting one, Road to Health booklet. Hunger leading to fatigue, deworming, weight, height. Education on healthy food options, correct allocations, proper diet. Okay, from Benita to everyone, infant mortality rate in the chat box. Okay, what's coming through on the Mentimeter is, of course, confidential. We can't tell who is putting it in, but I can on the chat box. Hence, Benita got the recognition for her input. Okay, so I think this is going to be also really interesting once we download it to be able to see what are the most common terms, you know, that have actually come up, and we'll analyze this and put it in the meeting highlights as well. So I think it does really sort of show where, you know, what the focus of people's work is, and the link then between nutrition, education, and evaluation. Okay, Tandi's also put in there mental development, growth, and health in the chat box. Thank you. Appropriate initial requirements by age. Okay, Tandeka, should we move on to the third question?
Yes, Maggie, let's move on to the third question. From an evaluation perspective, what do you think would be the main indicator to track the progress and success of a nutrition program?
Thank you. So this is not only for the evaluators on this in this COP, but for everyone. What is important for you in terms of tracking the progress and success of the nutritional program? Stunting levels, the first one that's come through. Mm-hmm. Serving a nutritious meal on time, lead versus lag, having a core group, changes in height for age, road to health card, codes not stunting. So once again, the stunting levels, health messages, milestones, BMIs, anthropometric measurements, school attendance as an outcome, looking at evidence, obesity, overweight, underweight, and short stature, obesity there. Let's see what that one says. Measuring weight and height before and after to see if there's growth. Monitoring of food delivered to schools, child performance. And that sort of goes with child attendance one. Compliance to health and food safety standards. Monitoring the food that's delivered. Increased number of children attending. The impact of dosages and how many meals are provided. Breastfeeding, particularly for mothers, and infant programs, learner interest in agriculture and nutrition. I like that one. I hadn't thought of that one before. Parents getting more involved in the education of children, need to have a group over time to measure to see improvement. kitchen safety, wasting. Are parents more likely to pay fees when we are feeding their kids? Very interesting question there. Sandeka, anything that sort of strikes you from what's coming through?
Well, the one you just mentioned about are parents likely to pay fees when we are feeding kids has actually struck me the most.
Yeah.
And I'm also quite keen. I think the first speakers, Maggie, will also touch a little bit on, indicators that people need to look out for when monitoring nutrition. So I'm quite interested to also hear, what comes, what they come up with in comparison to what the audience has also shared with us.
Great, Ulla. Sorry,
no, I think we could also just share the resource with the definitions and terms. I'm not sure if everybody had received it, the one that you mentioned on the terms for nutrition as well as monitoring and evaluation.
Great, excellent. And I think looking at this as well, I think there are a lot more terms that we could actually add to that resource. And I think what would also be nice is taking these through in the meeting highlights in terms of, almost a sort of list of terms and indicators that this group have put together. I think that would be a really useful resource for everyone. And obviously it would be specific to programs and what everyone is involved in. But I think there's some real richness and relevance of what is coming up on here. So a huge thank you to everyone for sharing. Okay, so I think let's keep them coming in, but I think we're going to move over now, also in the interest of time, to our first presentation, which is on ECD nutrition programs, starting the conversation about monitoring and evaluation. And we've got two speakers that are coming on board to talk to us about this. We've got Jessica Roonasen Baker. She's a social worker and a researcher, and congratulations on recently completing your PhD at Stellenbosch University. And the focus of that was on essential management competencies of ECD principles in South Africa. Jessica is an experienced social worker, ECD training and supervisor, and has demonstrated expertise in facilitation, program development, as well as monitoring and evaluation. Jessica launched the Relate Your Research, a social work podcast, and has a passion for communication on data in an approachable way. She's also a Mandela Rhodes Scholar and was awarded the National Development Agency ECD Awards. She got the first place Facilitator of the Year in 2018, and also the National Development Youth Agency Award for Civil Society category. So congratulations on that. Jessica is passionate about ECD, nutrition, and promoting learning within organizations. We also have Anna-Marie Muller, so welcome to this COP. Anna-Marie drives the work of the DG Murray Trust around nutrition and food systems. Previously, whilst on secondment to the Grow Great campaign, she supported their data-driven advocacy work and helped to establish a coalition of civil society partners working towards the extension of the child support grant into pregnancy. She's got an academic background in public health, nutrition, and sustainable development. So a warm welcome to both of you. I'm going to hand over to you. I'm not sure who's starting off, so thank you.
Hello.
Thank you. Good morning.
Morning. Hi, everyone.
Can you just put your presentation onto full screen mode for us? Make it easier to see, and then we can hear you all well, so thank you.
Oh, brilliant. Let's see. Maybe a thumbs up just so we can check.
Yes, you're on. Thank you.
Fantastic. Thank you for that lovely introduction. It's so exciting to be teaming with Anna-Marie. I think and maybe she would like to jump in for a moment here, but it's so wonderful to be able to share data, but it's also wonderful to come in from such different approaches. So I hope you'll all benefit from the collaboration there.
Yeah, thank you, Jessica. We've really thought about what are practical things to chat about. So we're going to Jessica is going to lead the conversation, and then I'll come in at the end a little bit with my funder hat on, but also with the public health nutritionist hat on, and we'll just, hopefully it will all kind of melt together in a useful way. And we're very happy to take questions and chat through these things. So thanks for the opportunity and the invitation from Bridge.
Yeah, I think Bridge is such a fantastic platform because you're bringing together, like a bridge would, various platforms, but also various stakeholders. So we're very aware that there are lots of people on this call, and we've tried to take down the notch in some way from the technical side of M&E and start this as a conversation. So please feel free to use the chat box. I guess most people on this call do not need to be told why the first 1,000 days are important, but the value behind this community and the topic today really is, where does nutrition fit in to these first 1,000 days? And when we start to monitor the first 1,000 days, it becomes quite challenging because, believe it or not, nutrition is slotting into so many elements of ECD. And I think that's something that only recently people have started to tap into and understand. It's not just feeding children, although that is a huge component of it, and the menu does matter. In terms of the protection and care of children, the way in which the kitchen is running and functions, the way it's set up matters. Of course, kitchen safety, wash is important, the water, access to water becomes important. And that's all just talking about the facility. What about the classroom? Then we start to speak about curriculums that can touch on themes like nutrition or healthy eating or water. Even the idea of vegetables that are available within a season. You know, there are ideas that we could start to integrate into our themes and learning activities, coloring books, games, the way that we teach and talk about nutrition is also an element of nutrition in ECD programming. So maybe you were expecting me to jump into an M&E terminology, but actually my idea with this intro was really just to start to talk about how many ways we start to see nutrition in ECD. And then you actually get the health and the growth monitoring, you get the immunizations and the deworming. I don't need to tell you what that is, because clearly from our intro activity, you actually have begun to sort of talk about this. These terms 10 years ago were not in an ECD forum ever, really. These are new. So it's very exciting that it's becoming a lot more common for us to talk about stunting and malnutrition, and the Road to Health book. That was exciting to see that pop up there. And so, yes, that is why we are here today, to talk about how many elements we could actually monitor in our ECD programs. And I'm going to share some of the programs and projects I've been involved in. Here's some terminology for you, just to keep everyone comfortable. Of course, we know that monitoring is an ongoing process. It's something that should be happening continually. Evaluation is something that happens at the end. And we usually touch on these two terms together because you want to be learning. It doesn't help us if we only monitor projects at the end, because you may be doing something, or something may be happening that you need to intervene or do in the middle of your project. And funders actually need to be aware of how flexible programs need to be to the whole monitoring process. This is interesting because, let's open this conversation, it shouldn't be a policing activity. It really should be about improving. Oh, that's fun. Someone else wants to know about the M&E of nutrition programs. And so we should be understanding that, and the conversations we have with donors should be very much along the lines of, let's improve the service, let's improve the resources and the products that we are making. If you have a child, I recently had a child, and you wouldn't want to monitor them only at the end of their childhood. That does not make sense. And so there is a reason that there are stages that they need to be seen by a nurse, by a health professional. And the whole idea of stages of development is something that we've spoken about so often in a classroom setting and in terms of cognitive development. But when we start to talk about health, all of a sudden people get very uncomfortable for some reason. I think it's this thing of like, maybe health professionals know more than we do, or it gets very technical very quickly. But it's really important that this conversation, that we open up this conversation, because if we're not monitoring, we actually can't improve our evaluations at the end of our projects. And Anna-Marie may speak a little bit about how actually accessible this information is to us. In the past, I think that NGOs have tended to be very donor focused with their evaluations, with their monitoring, because of course, you need funding to be able to run these projects. And sometimes that becomes quite like numbers focused, beneficiary based focused. How many people are you feeding? Or how many people are you training? But there are actually many other many other evaluation opportunities and monitoring opportunities of programs that we can do. Impact is at the end, right? What impact did we have? And sometimes those are quite costly. So there's a difference between our immediate evaluations and our immediate measurements and our immediate monitoring, right? The things you do when the program is happening. And then there's also the programs and the evaluations that happen after the fact. And often budget dictates this, I think. And this is a conversation to be had, because I think so much pressure is put on NGOs often to feel like they need to be doing these massive evaluations, when really we need to be thinking about why we're evaluating what we are evaluating and what we can use the data for in a helpful and meaningful way, rather than just doing it for data's sake, just for the sake of ticking the box of we reached this many people. Of course, that does matter. I hear that, but it is really valuable for us if we want to be doing due diligence and if we want to be actually using donors' money accountably, to be more participatory in the way we do our evaluations so that our beneficiaries are part of the process. The idea of analyzing policy is also something quite new, but is a form of monitoring and evaluation in our own NGOs even, or organizations. Resource mapping, and I feel like qualitative feedback also is an often neglected form of monitoring as we go. There are components that you can measure, and just to keep everyone comfortable on the terminology side, of course, you can measure what you're putting in. You can measure the road and the journey along the way. You can measure what you're putting out, the outputs, and the outcomes, what you intended to achieve. And all of this will be very different for every organization. I see some wonderful organizations represented here today. I mean, you just have to scroll through the attendance list to see how fantastic this community is. Each one of you will evaluate differently. Each one of you will monitor differently, and that's okay, and that's a good thing. And so we can monitor nutritional status. We can monitor how many times a child is immunized or not immunized, and deworming, the milestones, those are very health focused. We can also measure and monitor nutrition messages. How well are we training and talking about breastfeeding? How well are we talking about complementary feeding? Are we aligning with the Road to Health booklet messages, for example? Are we a very Western narrative, where we talk about things that aren't actually relevant sometimes to our communities? Facilities I've spoken about, and obviously then you come to the menu, the lunch boxes that are coming to these centers, or the donor requirements maybe. And so this discussion, I hope, is starting to trigger some ideas for you, perhaps, around how many more elements in your programs, in your centers, that could actually be monitored, not because you're trying to police your centers or your beneficiaries, but because you're trying to find new ways and gaps to support them on their nutrition journey. Some of our projects that we endeavored to establish these monitoring opportunities were successful, and some were actually really hard journeys. And I wanted to say that because it really is an organizational learning approach. I don't claim to know all in this field by any stretch. I'm not a dietitian, and that's maybe encouraging, I hope to all of you, that you don't actually need to understand all the technicalities, because there are people that can do that. But it is amazing to start to champion the idea of nutrition, in the ECD space. That is what we need. We need leaders who will start to mention the idea of nutrition when donors are talking about potential projects. So we began nutrition training in 2015, Nelson Mandela Bay, as part of the IMAP project with a local NGO. And we trained teachers. I mean, it's a great place to start. This is probably very familiar to all of you. We taught them how to measure, how to weigh, MUAC. It was a fantastic time. We touched on really relevant topics, Road to Health book, the charts, there were resources, I mean, all the fun. And our monitoring was actually very simple. Attendance and a pre-test, a post-test. Let's test knowledge, right? We then got a little bit ambitious and decided we were also going to measure the children. And so that requires a little bit of logistics, organization. We checked some deworming, we checked the Road to Health books, we began a referral system. Oh my goodness. You must imagine how this is like steamrolling in some ways, because you discover one problem, you discover a new problem, and all of a sudden, what began as simple training turned into this small scale project, which I think was really beneficial for us because it opened up a lot of opportunity to discuss with ECD practitioners their challenges with health. So this is our first ever report. I feel a little bit shy to share this with you because actually we knew very little about what we were doing. And I think we've learned so much along the way. Throughout our 3-year process of training these teachers, we trained teachers and then we trained parents. So this is when I say we were focused on attendance, right, which is valuable, but we grew. And I hope that this is showcasing to you how simple actually monitoring can be, because attendance is a form of monitoring. We then got fancy and we then started, we partnered with Nelson Mandela University. We got the students involved. It's a wonderful way to expose young people to nutrition and ECD, which isn't always part of the curriculum, but throw them in there. It's a wonderful learning game. So we picked 3 schools. This was a very small project at the time. We measured, we weighed. It was the first time we plotted this onto a graph. And I'm not going to go into the details for you because this is really just explaining how we trial and errored this thing and really began to understand that nutrition was so valuable to these teachers that they continually wanted to be involved, whatever it meant. They were excited about the parent programs, they were excited about the training, and then when the students came, oh my goodness, you know, that's a whole thing. We then started to see own initiatives of the teachers pop up. I hope you're seeing data all over, because this is really unique ways of using data that doesn't have to be scary or difficult or technical. And these are all indicators of success. This was from one of our site visits. I had to take a photo because this teacher has like assessed that there is an obese and 2 underweight children in her class. From a training where she learned how to monitor, she learned how to measure and weigh the children. And when I saw this attendance register, I just couldn't believe actually that this teacher was doing it all on her own. These teachers are champions in their own right. We saw some gardens pop up all over the show. And that's also an indicator of training success. So even though our attendance data was good, in my opinion, these photos tell a really beautiful story. We then began to test some messages through the Saka Setu program. This was also in Nelson Mandela Bay. I'm from PE, by the way, so that is why a lot of this work is coming from Eastern Cape. But we ran some parent gatherings, and this was really a participatory initiative. The teachers began to measure MUAC. There it is for everyone to see. The evidence was beautiful because they were capturing the data, bringing it into our NGO. We were analyzing and assessing where these teachers were at. Believe it or not, they are quite incredible. I'm sure you can believe it, actually. We saw groups pop up all over the city, 30 of them, and supporting breastfeeding, supporting complementary feeding. The one group even made their own puree together. We then tested some resources to do with WASH. This was pre-COVID, so I feel like that was fairly innovative at the time. And looking at foods that were healthy in a child-friendly format. This is fantastic work because we should be testing these messages with the children too. And the results may not be in numbers, but as you can see, there's a lot of engagement happening here. I think qualitative feedback is also really valuable, and we saw that through some of our focus groups and discussions where the beneficiaries were saying, well, we love this. We love having these conversations where we get to give feedback to you as the service provider. We love to be able to tell you what we enjoy about the training and what we don't. And they give me hope when I attend these meeting days. I mean, how incredible. Ooh, I've skipped here. We were part of an evaluation of the nutrition messages for the Feel a Baby campaign. Maybe some of you are familiar with the blue babies, and this is fairly health focused. But I thought I'd show you what the data can look like, because if you have a conversation, you can record that and share it with a donor. And that adds to your validity of the data that you're creating to show, wow, these people are really caring about the resources we're creating. So you'll see here some of the focus groups, the participants would share with us, oh, well, we like this, it's attractive, or I don't know why they're blue. Can you explain that to us, why they're blue? We need pink babies. That was one of the conversations we had. Different colors should be represented. There's no picture. What can we do about this? And as a result, there were some amazing changes that were made to these resources because of the feedback. So prompts and pictures were added to the back to help with a facilitator being able to use the blue babies practically. A useful tool and an ideal data source is the Road to Health book that popped up in our quiz this morning. And in terms of indicators, there is stacks of data sitting there in the book. I think something that we could begin to talk about is how valuable this Road to Health book is for our teachers and for our NGOs, because it's data waiting to be utilized. And there is a network of services, primary healthcare services available for them if there are issues. So this is actually a wonderful entry point for us if we want to start to measure and test and trial, are our messages working and is the work we're doing making an impact. Coming in for a landing here, and just to say that creating an organization that learns is really important. And I think we need to move away from M&E being this very difficult and hard to understand process to really being a learning one. I hope this has been a breath of fresh air in some ways, just to start to think through how we can build shared learning. We should be sharing what we discover, not only with our donor, but with each other. And that's the point of a community of practice. We always speak about play being important to learn, and I want to challenge all of you to start to play with the way you use data. I hope that has been showcased a little in my slides today. That team development can actually improve your learning. So use your reports for more than just donor purposes or for the tick box exercise of it. But if we can start to remove the fear around data, I think it could be actually so fun. Okay. Yeah, we can use technology in creative ways. Google Forms are a great way to capture data, of course. And we should encourage new skills all the time. We should be talking about innovation, green thinking, easier ways of doing what we're up to. And collaboration means that you don't have to be the expert. And that's exciting for us. That's encouraging for the ECD sector. We're developing and we're learning together. And I hope that this is encouraging to you. Over to you, Anna.
Thanks. So just as I think that Jessica's presentation is really practical, but of course, also just to share a little bit more of the technical stuff, you might, when you are thinking about nutrition, be faced with a table like the one or a graph, a chart like the one that's on the slide at the moment, showing you all these different indicators over time, and lots of different surveys are done. At the moment, the Department of Agriculture and some other government departments in partnership with the Human Sciences Research Council is doing the National Food and Nutrition Security Survey. Next year, the National Dietary Intake Survey is going to be taking place. So we've got lots of opportunities where very high level data is being collected about the state of nutrition in the country. Of course, for the purposes of this conversation, we're really interested in the nutrition of children under 5. And so why do we do surveys? Maybe just as a quick reflection, I think it's really useful for us to have population level data. South Africa is a member of the World Health Assembly. We've said we're going to try and achieve the Sustainable Development Goals. So all of these indicators are really important for those external processes, and also for the National Department of Health and other kind of very high level processes to understand what's happening. But they do give us a snapshot. They're cross-sectional, so they give us like a one moment in time. This is how many children are affected by, on this chart, wasting, underweight, stunting, etc. These are really useful to be used as a baseline, so we can compare changes, the impact or changes over time. So as you can see, I'm going to zoom in on stunting, which is my most interesting nutrition indicator. Not much has changed. The first one here is from 1999. 26% of children were stunted then, or suffering from stunting then. The most recent one, the South African Demographic and Health Survey, 27%. Like, these aren't very good results. Like, we're not making progress. So we really have to start thinking innovatively, because clearly what we're doing isn't good enough. Jess, can you go to the next slide, please? Mm-hmm. So I'm going to be chatting a little bit about what an organization I've worked with, the Grow Great campaign, has done. And we've really said, let's use data in very powerful ways. So what I'm showing you here are the results of 2 community surveys that we've done to identify the prevalence of stunting in 2 communities, one in the Eastern Cape and one in the Western Cape, to firstly identify the prevalence of stunting. But we didn't just want to know how many kids here are affected by this. We also wanted to understand what were the drivers. And I think this is where it's really powerful to use data in strong ways. That we want to be able to plan our response. Because the data that's presented in the previous slide, this is all, I guess, the question is what, you know, we know that nothing's changed for stunting since the 1990s. So what are we doing? How are we going to change things? And so what's really powerful about local surveys, and some of you might have seen enumerators going out measuring children. This is something which, you know, is happening. So many different surveys are always happening. So this is why they're important, is because they allow us to target our interventions and think about our interventions. So when we read the data on nutrition and you read these big global publications, you'll see lists and lists of drivers or causes of stunting, things that when they are in an environment increase the likelihood of stunting occurring. But what we found just in these 2 surveys, I know it might not be super clear for you, but what we've seen is we've done the same questionnaire and we've done the same methodology in both settings. And we found that the drivers of stunting are very different in these 2 communities. And so when you've got a national survey, your sample in a particular province, you know, the Western Cape sample for the South African Demographic and Health Survey is under 100 children. So it's not really giving us the gritty on the ground detail about what is happening there for these children. Whereas these kind of surveys do give you that edge where you can say, okay, for the Department of Health in Worcester or in Kanduli, what are they able to do to change the statistics? And really, the statistics don't matter. It's about changing the outcomes of these children. Like, these kids deserve to grow up happy and healthy and stimulated. But something in what's happening at the moment isn't working for them. So how can we use the information we get from surveys to really make a change. And I can share one really great example of how the survey in Worcester has already brought some great changes. So community health typically have MUAC tapes, which are those tapes that Jessica showed, that they have a green, orange, and red bit, and they go around the arm of the child, and they identify if the child is suffering from malnutrition. But unfortunately, it's a very good screening tool, but it's not as good for each type of malnutrition. So they sometimes miss things. And what we showed in Worcester is that having a scale is a really important tool to allow us to find the problem better. And so since the survey, the Department of Health has actually bought scales for community health workers. So they've put the right tool in the hands of those who are out there trying to identify problems and refer children appropriately. And so, wow, this is like, we've used data, we've presented it to people who make decisions about things like what is purchased, what's in the budget of the department, and it's made an impact. It's really, so what I guess what I'm getting at here is to say that data shouldn't just sit in a report. We really have to use it, and we can achieve lots of different things with it.
So you've gone on to mute, Anna. Can you just unmute yourself?
Sorry, I don't know how that happened.
No problem.
So yes, I guess, so for us as donors then, just to quickly run to the end of my spiel, is to say that, you know, we want to see the impact of your programs, but we also want to see how you use that data to change what you do. And so I think what Jessica shared earlier is about the learning. And from our perspective, at least speaking on behalf of the DG Murray Trust, we really want to see the learning, and we want to learn with you. And data is one way to help that journey take place. And so it is important when you know roughly what the situation is, you know, when you've got a nice baseline and you can say, oh, we think we've made this impact. Of course, no data is ever going to give you the full picture. There are always going to be things that could also be at play that you just haven't tracked. So it's let's also not put it on this pedestal that it's the be all and end all. But it's useful to have data, and I personally think that the advocacy kind of firepower that it gives us is something which we should be exploiting more and more. And there are so many anecdotal stories about nutrition being important for children's cognitive outcomes. You know, when we use tools like the ELOM, etc., and we see, oh, there is actually a difference in outcomes for kids who have evidence of malnutrition versus kids who don't. Those kind of stories we need to elevate from just the anecdotal to really use them in our intervention planning, and also to really put nutrition up there as important as reading speed and those kind of things, that we really say that we cannot achieve the outcomes we want in the ECD program if we don't have the right nutrition there. And so they're not competing with each other. So when you talk to donors, I think it's important to say holistically, this is what we need for children to thrive. And we see these things as complementary. So don't make us choose which line item is more important. Really sell that argument that these things are complementary to each other, and then engage in a conversation. Show that nuance in your applications. As a quick side note there for anybody writing one at the moment, we really want to see how things intersect with each other, because it's in that gray, messy bit where the magic often happens. And so, yeah, data is an important tool for that, but it's a tool that we can use in interesting ways. And it's really there to help us get better at what we do. That's, I guess, the long and the short of it. So I'm going to stop there. Hope
Great.
that wasn't too muddly.
No, thank you. Really interesting. So thank you to both of you for that. I think we're going to just open it up for any comments or questions. If people can just either put a hand up or put it in the chat. But also a number of people have commented in terms of requesting the presentation on it. So we have responded regarding that. But Jessica, if I could just ask you to amend the slide with your register, because it's sharing people's personal information and we all have to be very aware of that. So if we could just take the names of the people off that one slide before you actually share it with us, that would be great. Okay, just to be very clear on our POPI regulations now. Thank you. Okay, so any comments or questions? I see in the chat box that Praviana has said that data is critical and if used appropriately can make a huge difference. Stories that are more qualitative information is just as essential. So I think really echoing, Anna-Marie, what you're saying about it. Melissa, I can see your hand. Do you want to come in here?
Yeah, no, it's just very interesting because in the monitoring and evaluation CoP, one of the debates we've endlessly had is the fact that very often evaluations of programs do not get shared. Funders or don't want to share them and they sit on evaluations, and there's all this data which is so useful to implementers, which actually never goes into the public domain. So I think the point about sharing data, not just with program implementers, but even with people who work on the ground, the practitioners and so on, to actually understand, what these things mean is actually really important. And it's been an ongoing discussion in the M&E CoP about how to share this data, and specifically from contracted monitoring and evaluations that are done, to share it at all the different levels where it would be really useful. So I'm grateful for you to bring that up again, and just to note that we endlessly talk about this. And I think there's a bit more openness on the part of funders than there was like 5 years ago or so, but it's really important to think about how to share this.
Anna-Marie.
If I may quickly reply, I think for Grow Great, it's been really important. So we've done 2 community surveys so far, and we're doing a further, I think 7 to cover all the provinces in the country. And it's really important for us to not only present the results in like a webinar or a very formal setting, but really to say, who are the practitioners who engage with these children and how can we present it to them? Let's go on the radio, let's have a town hall meeting. Let's talk to, in our context, Flourish franchisees who are presenting antenatal and postnatal classes to moms, and really say, this is the data that's about the kids that are growing up in your environment. You know them, you know their context so much better than us. Help us elicit what is in this data, the scary science that is actually useful to you. And so to be really, I think, I love what you're saying, Melissa, that it really needs to be a conversation, not just an extraction of data from a community, but then to go back and say, this is what we found. What does this mean to you? How can you use this? Does this add up? And then we see what happens. So it's, I'm in full support of that statement.
Great. Praviana, I can see your hand, and then I know you also put something in the commented in the chat. Please come in here.
Can you hear me?
Yes, you can.
I'm an integrative nutrition health coach, and we have 2 concepts in that space that talk around nutrition. The one is primary foods and the other secondary foods. Secondary foods are what we consider the foods that enter our bodies through our mouths, basically food, beverages, and supplements. But we also place a lot of emphasis on primary foods, which are also the other things that enter our bodies and impact our well-being, but not through our mouths. Things like sleep, quality and quantity, things like relationships, physical activity, spiritual practice, and so forth, okay? I just wanted to put that out there as other indicators, because it's not just about what you eat. If you're not sleeping enough, the kid is not getting enough of the right quality of sleep, it's going to have a major impact on brain, on learning, and a whole lot of other things. The other thing I wanted to just put out there was the role of primary caregivers, the moms, the grandmothers, the dads, the older siblings, as primary providers of critical source data. The fact of the matter is that we only have the kids in the classroom for so many hours a day, so many days a month, so many months in the year. But the biggest influence around their nutrition, either way, is what happens in the house, notwithstanding the fact that most families can barely afford to put proper nutrition on the table. That's beside the point also. And in the work that we do as coaches with young children and teenagers and so forth, we find that a lot of the bad habits around eating actually stem from the house, from doing what the parents do and not what the parents say. And for me, a big part of research is also about getting people to change undesirable behaviors and practices towards more desirable ones. So if we can find a way to integrate the primary caregivers, the households into this, I think it's going to have a significant impact on the nutritional status of our families and our children. One simple example, we talk about eat like the rainbow, the colors of the rainbow. If we could provide templates through the ECD sites for all the parents to stick on the fridge or on the wall, and every day to get kids to say, okay, today I'm eating this color of the rainbow, tomorrow, and in a week, I've eaten all 7 colors. And then, the kid takes it to school and says, teacher, see, this is what I ate, and it becomes fun and the kids talk about it. Then you're changing behavior. The other big challenge is excess sugar.
Can we find, sorry, just ask you to keep it very short, just that we're running out of time. Thank you.
Pull a template again for the wall where every day they track how many teaspoons of sugar and encourage them to, go less and less and less. Because for me, research should be about behavior change at the end of the day. Thank you.
Great, thank you. And if you've got any of these resources, links to them, please do put them in the chat box. I think they sound really interesting ones. So thank you for that.
Thank you. Bye-bye.
Great. I think that there are a number of comments that are coming up in the chat box that I think if everyone can have a look at them and respond to them. I think what's interesting is it's also coming up around how do we engage with government and how do we also break some of the silos between health, education, etc. on it, which I think is really a really important issue. And hoping that after we're going to do a very short 5-minute break. But if we can then, when we come back, is to really hear about the National School Nutrition Programme and the evaluation of that. So firstly, a huge thank you to Jessica and Anne-Marie for that. I think it was really accessible, very interesting, very straightforward as well, which is absolutely wonderful to hear. Please do stay on. We're going to be able to have more of a discussion as well after the next presentation. So going to ask everyone if we can have a 5-minute break just to refresh and then we'll come back. So we'll be back, well, let's make it a 7-minute break. Come back at 11:10. Thank you very much. Great. Welcome back, everyone. I hope you're all back. Please do continue to put comments, resources, and any questions into the chat box. We are going to move onto our second presentation, and that is around the government evaluation of the National Schools Nutrition Program. And we are very pleased to have now Dawn Sediti with us from the Department of Basic Education. She joined the Department of Basic Education in 2007. She's currently the Director of the National Schools Nutrition Program. So we're very pleased to have her today. She's developed competencies in policy formulation, planning, and implementation. As a program manager, she was instrumental in facilitating the transfer of the school nutrition program and in developing its capacity at all levels of implementation in the education sector. So that's a province, district, and at circuit level. Prior to this, she was with the Department of Social Development as the Chief Social Worker. She later joined the Gauteng Department of Education in 2003 to lead the transfer of the school nutrition program from the Department of Health. Part of the responsibilities included overseeing the management of the conditional grant funds that were transferred to provincial education departments and compliance requirements towards the effective implementation of the National Schools Nutrition Program in all 9 provinces. She has honed her skills and gained experience in project management, strategy, and policy development, as well as nutrition-related matters, among others. She's passionate about serving communities, especially children with vulnerabilities. So it's really nice to have you as part of the COP today. So now I'm going to hand over to you for your presentation. And please, if there are any other members of your team that you'd like to introduce, please do introduce them. Thank you.
Good morning and good morning to all. Thank you very much for the invitation. And thank you to all the participants for affording me this opportunity. I really appreciate it. My name is Nell Sediti. Yes, I hope you will be able to allow me to share the screen so that we can start.
We can see the screen. If you can also put it onto the full screen mode, that would help for us. Perfect. Thank you. Over to you.
All right. Thank you. Juanita, for me. All right, Majis, thank you so much once again. Like I've indicated, my name is Nell Sediti, and I'm responsible for the National School Nutrition Program. I'm normally one who would avoid titles, but if anyone wants to know, I'm the director for the National School Nutrition Program at the Department of Basic Education. So thank you very much. I will not be able to start the video. So if anyone wants to see my face, unfortunately not today, because I think I haven't fixed my desktop. So I will just proceed to talk and share the information that I have with you. Let me just start by also acknowledging our partners. We have Fuel. Fuel is the NPO that we've worked with for quite a number of years, I think over 10 years now, if not 13. And the Fuel is actually an acronym for Feed, Uplift, Educate, and Love. And they have been instrumental, in terms of this partnership in trying to assist and support the Department of Education in the monitoring and evaluation quite recently when they joined another directorate of ours in terms of the evaluation of the program. So I just thought that I do have quite a number of slides, but I'm going to skip through quite a number of them, noting the time limitations and just speak to perhaps the most critical ones. But I thought that I should just share with you, quite a whole lot of information that I thought important for the participants, just to have an overview of the school nutrition program. So the first one would be just to outline the overview and the M&E strategy and its methodology, as well as do give you a perspective in terms of the M&E evaluation framework, and then give you also just a snapshot of the MRR, what I have indicated as fuel, having supported the Department of Basic Education in terms of developing this methodology. And then I will touch on, which is of much interest to you, on the 2016 implementation evaluation, as well as showing as to how we have integrated plans and what outcomes we have achieved. So as a form of a background, as you all know that the school nutrition program was a presidential lead program in 1994, just at the onset of our democracy. And it was transferred to the Department of Basic Education around 2002 following a cabinet resolution. And at the time, it targeted primary school learners, but now with the advance of funds towards extending it to much more than just primary school learners, we extended it to the secondary schools as well as identified special schools. And the funding comes from Treasury in the form of a conditional grant. So we are guided by the conditional grant framework, which is gazetted in the Division of Revenue Act. So at the moment, we are feeding just over 9.6 million learners in 21,000, about 21,000 primary, secondary, and identified special schools. And we have a criteria in terms of our quintiling system, which I will not talk about right now, but it's basically just to indicate that we target, schools that are located in poverty-stricken areas. Our funding model, our procurement model is based on the centralized and the decentralized model. And the centralized model is when a provincial education receives money, receives the funds from Treasury, and then they actually solicit they solicit food items through a centralized procurement model by awarding the service providers, the bids in order for them to deliver food to schools. And then on the other hand, we have also the decentralized funding, which is the transfer of funds directly to schools, where the school principals as well as the school governing bodies actually determine as to how the program should be operationalized, although they would then follow the guidelines as provided by the national department. And this is based on provincial menus, and these are school-specific menus where a number of learners as well as quantities are procured, and these are then prepared at the school sites, as you may be aware. So we do have at the end, in terms of our outcome, we do have serving of nutritious meals on time. Now, in terms of our key objectives, these are just to provide nutritious meals to learners in identified schools so that they can access education, as well as improving school attendance and learning abilities. We also promote nutrition education among school learners and school communities. So we have quite a number of activities and nutrition awareness campaigns within schools where we also involve the parents. All right, now coming to I need to minimize this because I can't see. All right, let me go back to, all right, now touching on the framework that we have developed over the years, we have quite a well-oiled monitoring system. And I must say that the monitoring system is a continuum towards evaluation. As has been mentioned by the previous speaker, I actually like the fact that the monitoring is actually what is happening at present, and the evaluation happens at the end. And this is exactly what we do. And the monitoring currently is at all levels of implementation. In other words, the national department does monitor in terms of oversight, and then the provincial education as well as the districts. I will include the districts under provincial NSNP, where the district have monitors that are at the coal face of the program. And then we have the evaluations that we do on an annual basis. And I will call that an internal evaluation because this is mandatory, which is then regulated by the Division of Revenue Act, where it is expected that for every grant that is being provided to provincial education, in terms of performance, we need to evaluate it, and therefore we do have the grant management as well as fuel that are assisting the National School Nutrition Program in making sure that we do have that internal evaluation. And then we have the external one, which would then involve other departments like DPME, Department of Planning and Monitoring and Evaluation. We do have the Public Service Commission that have previously evaluated the program. We do have the UNICEF, we do have FAO, and many other international agencies that have come on board in order to help us to evaluate the program. And this we do, let's say, every 5 years. I must say that with the 2016 evaluation that I will talk to you about later on, you will note that perhaps we are actually due for another external evaluation. Now, at a provincial level, yes, we do have dedicated monitors, as I have indicated, at the district level, and we do have a sample in terms of monitoring plans, as well as making sure that we have a number of schools that we would monitor over the year, over the financial year. And then we do apply the MRR, as I've indicated. I'll just speak a little bit on that, but please feel free to also ask questions from Fuel. I hope they have joined this meeting because I extended this meeting to them. And then we do have the 9 aligned provincial tools. In other words, the provinces have actually determined as to, they have designed and customized their monitoring tool in order for them to make sure that they measure the relevant key indicators, but they are those prime ones that I'll talk to you later on. All right, I've spoken about the grant management, yes, having to assist us in terms of the school. Let me not talk about that quite in length, but in a nutshell, I must say that we have those 2 key pillars of the evaluation at the end, which I think it's much more of interest in this forum. Then in terms of yes, I've indicated that we do have DPME on board and the DBE grant management, which is helping towards the evaluation of the program. Yes, let me just skip that one. Now, when it comes to the next slide, I just wanted to give you a synopsis of how we monitor, because we do, as I've indicated, we do monitor at all levels, at the national, provincial, and district. And at the school monitoring by the national, we do a sample size of about 120 schools. And then the district, we also monitor the district because the district are at the heart of where the implementation is, and they are the ones that support the schools. So we make sure that the provincial department supports the districts in such a way that they can be able to manage and support the schools in terms of the implementation in its totality. So we do have the district monitoring as well as the provincial monitoring. And therefore, for each and every level, you would find that we have developed the tools that are commensurate to whatever indicators or the needs that are related to that level of implementation. We do have the annual monitoring plans that are also aligned with our provincial business plans that provinces would also on their own, come up with those monitoring plans, because we want to make sure that at least they reach a certain number of schools, which I will talk about perhaps later in one slide. I have also indicated the monitoring schools, but I must say that the impact of COVID-19 pandemic has actually made it quite difficult for us to have the observations, because we really believe that having to do the unannounced visits actually give us much more authenticity in terms of the data that we are being provided by provincial education departments and the district. So currently we have been doing our monitoring telephonically using the very same tools, but we have adjusted them to ensure that we do have the relevant data that we want to extrapolate. Now, in terms of the MRR, as I've indicated, Fuel is here and they can perhaps expand much more if there are any questions from the floor on the MRR. The MRR is to monitor, is the monitoring, reporting, and responding. And the monitoring aspect is just for us to collect the data, the right information. And that right information is then the one that we use to measure and assess whether the program is performing successfully, and we translate that into a report. And that report we analyze so that we can understand. And the beauty about this is that the monitors at the district level, they actually work with school principals in that monitoring tool, which actually measures the key performance indicators. And in that way, they are able to come to the third element, which is the response. And the response, as I say, you know, the beauty about it is that it is a response that is being discussed with the school principals. Part of those key performance indicators, there is perhaps a gap. There would be then a discussion between the monitor as well as the school principals to say, okay, what do we do next in terms of making sure that there will be an improvement? And that improvement is actually measured in terms of the legions in color coding. So a red, and you know, like a robot, a red would then mean that there has been a shortage in terms of the food that was being provided, which was not in the right quantities or in the right quality in terms of the variety that we have set as a standard, in terms of the 3 food groups that we have set as a standard. So those KPIs, as I've mentioned here, they are just a few, but there are quite many. One of them is serving of portions, which is quantities, the health and safety, because we know that we don't have all kitchens that are up to, you know, the right health and safety standards. So we also measure that so that we can be able to say the SGBs as well as the district as well as the provincial departments, how can we support the school in order to improve those health and safety standards so that we make sure that we give learners the right, the appropriate meals as well as the delivery of it. Okay. And then this part, this slide, I think, let me just keep this. Okay, this slide may be of interest to you because I can see that you know the topic is around nutrition. But in terms of as I've indicated, the grant framework, we derive our mandate actually from the grant framework, and the grant framework actually stipulates all the requirements in terms of what we need to provide on a plate on a day-to-day basis. So we do have the food specifications that we have worked with the Department of Health, and these must contain at least a starch, a protein, and a fresh vegetable. And then the fresh vegetables should be served daily and vary between green and yellow. So we do follow the South African-based dietary guidelines of the Department of Health. So a variety of protein-rich foods should be served with raw sugar beans, be packed separately from sample, and that was done for a purpose because we could see that the suppliers that were providing us were actually shortchanging us in terms of the nutrient quantities or constitution of the nutrients in terms of, you know, combining the sample and the sugar. But that's another topic for another day. And then we do have soya beans. We should not be served more than twice a week. And you will, I want to indicate that in one of the findings that I will talk about on the 2016 evaluation by the department, DPME, as well as our outsourced researchers, there was a finding that soya beans is not quite favorable in schools. It's not quite favorable with learners. And therefore, we made these recommendations based on actually that finding from the 2016 evaluation. And then we also have a pilchard that should be served at least once a week because we're also trying to avoid menu fatigue. And then we recommend highly the high quality protein products that can replace the pilchard. And I will talk a little bit about what projects we have initiated so far in order to make sure that we have a variety of protein alternatives over a 5-day week. Okay, and pasteurized milks, of course, is one of the recommendations that we have made in terms of menus. So let me speak about the 2016 DPME. Okay. Right. The DPME evaluation in 2016, it was actually initiated through a collaboration between the DPME and the Department of Basic Education, because in the past we have had quite a number of attempts that we have made in order to evaluate the impact, to have an impact study for the nutrition program, and we failed. We failed because they also conducted a scoping study by the by the University of Stellenbosch. And the scoping study actually showed that we can't do an impact study because we did not have the control and experimental sample size, or other samples, in order for us to be able to say we can do the impact study. And this was basically because the nutrition program was transferred. I don't know what in English is, but because I'm a Kimberley girl, I would say food steward for those that are speaking Afrikaans, but we had to take the program over as it was. And therefore we couldn't take out any learner out of the nutrition program and then say that we cannot continue to maintain the program. So we just took it as it is. So the scoping study actually showed that there was no data that we can rely on in order for us to do an impact study. So the aim was to assess whether the aim of the study of this research was to assess whether the NSNP is being implemented in a way that is likely to result in significant health and educational benefits for learners. And this topic, this area was actually purposefully selected because, being in the education sector, we thought that we would want to also see as to whether there is any impact in terms of educational outcomes, but not only health aspects only, or the health status of the children. But I think it was also aimed at looking at the operationalization of the NSNP more than anything, being such a large program, having such a variety or many variables, and that could point to key indicators that we will identify. And hence we adopted the theory of change at that time, where we had a log frame we could use in order for us to identify even those key indicators. So we did have the key evaluation questions, and one of them were some of them were if the program was being implemented as planned, and then are there any procedures that were effective for timely delivery, and then were learners receiving quality meals and services, and then was the program also reaching the intended beneficiaries. So you could see that it was much more to do with the operation and how the program is being managed, as well as how the program is being implemented. Right. And then the next slide, I think I'll just speak a little bit on methodology on a few aspects. As I've indicated, this was not an impact evaluation, neither an economic evaluation or an audit, but it was an implementation evaluation. And we used a mixed method design, and then the data collection and analysis, as you all know, in terms of empirical methods. We did some literature reviews, and then as I've indicated, we used the theory of change, and then there were surveys, interviews, as well as analysis of cost and output data. So basically, Joint Education Trust as the outsourced, as the commissioned research unit, research agency was the one who am I taking, okay. I'll try and rush over. So the key findings of that evaluation of 2016 was actually reaffirmed our mandate, because they indicated that the intended beneficiaries are the ones that are receiving the NSNP meals. But there were those unintended beneficiaries, like the volunteer food handlers, as we call them, the educators and other stakeholders. And this was concerning for us, and we did some work on it, although I will indicate that we are not quite successful on this one when it comes to what we have achieved out of those findings. And then another one is that the learners were mostly receiving NSNP meals regularly. So it was confirming that, the program is a success, and therefore we needed just to make sure that we make improvements where there were gaps. And the other one was that it was noted, as I've indicated earlier on, that the two different procurement models, the most favorable one, or rather the most successful one, was the decentralized model. And this has actually influenced even at a level, at a strategic level, where we talk to the minister to say, that she must also talk to the MECs to influence them to move towards the decentralized model, because the centralized model has been marred with quite a number of unpleasant incidences in the past. But let me just pause there and say that in terms of those key findings and recommendations, we were able even to go further and integrate plans, integrate those recommendations and findings into plans. And what we did is that we developed an improvement plan, and this was done with the Department of DPME, if I may say so, where we attended to all those 15 recommendations and came up with a 2-year plan where we said, in terms of the 2-year plan, these are the action plans that we are going to take in terms of the short, medium to long-term outputs and outcomes. And I am glad to indicate that in terms of those improvement plan, we actually went further to have task teams for each and every area of work that we identified from the recommendations, from the findings, and put them into chunks of let me say, area of work, where we also identified project leaders so that they can be able to go on and work on those areas together with the provincial education departments. And I'm glad to say that these are the task teams, about 7 of them. We have made inroads in terms of quite a few of them, in terms of those recommendations. But let me just go back to the slide to say that in terms of those task teams, we are able also to see progress in the quarterly reports. And these quarterly reports are aligned to the annual performance plans that we would then report to our principals. And lastly, I would say that, in terms of the achievements, we can safely say that, we have had policy and strategic directions. We have had policy and strategic changes in terms of what we have learned from this evaluation. One of them is that we have started to progressively introduce school breakfast program, because it is one of the areas which was a gap as well. And we have also, like I've indicated, introduced more protein alternatives. Instead of repeating the soya in a 2-day, in a week, we have actually said, let us then introduce, right now we are working on a pilot project for chicken livers, canned chicken livers. So you would have canned fish, you would have soya, you would have canned chicken livers, as well as milk. And the other one is sand and beans, in terms of our protein alternative. So you can see that, in terms of that evaluation, we have made strides in making a shift towards making sure that we improve and we introduce new stuff. So we are making that progress as well. I think my last slide, Chair, would be this one, that we have partnerships, and I have acknowledged Fuel as our technical assistance and support in terms of capacity building, where we have had numerous workshops with Fuel in order to integrate at the level of a district, and that's the beauty of this partnership, that we have had, in engagement throughout, even in terms of our business planning process. So on an annual basis, we would meet and discuss all the plans for monitoring, as well as evaluations, and work with the grant management directorate in order to make sure that we do fulfill the mandate. In terms of DPME, I think I've mentioned that quite a number of times. And I thought that perhaps there would be opportunities here now that we have been introduced to Bridge. I must say that I am glad that we now know the community of practice, that the the members, or rather the participants are joined together to add value, to whatever it is that they are doing. Each and every one unit perhaps can contribute and add value to the evidence-based data collection that has been even presented this morning by Jessica and Anna Marie. I hope I have the name right. Yes. So I'm really happy and I'm really humbled that we are together. The last thought that I know that I haven't touched upon is the ECD, because I think I deduce that this is the area or the cohort of beneficiaries that many of the participants deal with. I'm sure everyone is aware that there is a mandate shift right now in terms of the ECD moving from the Department of Social Development to the Department of Basic Education. And I must reaffirm that, of course, we will be taking over that responsibility and that mandate on the 1st of April 2022. Plans are underway. We have worked our way in terms of making sure that we have those work areas. So, yeah, I forgot now the name, but we have divided ourselves in terms of areas of intervention, and health and nutrition is actually one area where we have worked together with other stakeholders, Department of Social Development, to make sure that we do take care and we do prepare ourselves. And one of the things that the minister just launched a few months ago, I think it was in August, where a census was commissioned so that we can know who is out there, whether registered or unregistered ECD centers. We need to know as to who is out there so that we can be able to have a baseline and start the work from there. So we're hoping that we will be engaging with you in future, and therefore we will continue to have the, invited. We hope that we will continue to be invited in this forum so that we can also learn the community of practices that are out there. So thank you very much, Chair, and thank you to all the participants.
Thank you very much for that very informative presentation and the insights, both in terms of the actual program, but also particularly in terms of the evaluation. So thank you. And there were a number of comments and questions in the chat box about the ECD, and how can this be extended into that sector. So thank you for addressing those questions as well. I think that just before we, address some of these questions in here, I don't know if Anna Marie or Jessica, you would like to just respond or highlight anything, just in terms of, how it sort of led on from your presentation. And Neo, if there's anything you would like to in specific, also flag from the previous presentations, do come in here.
Sure, I could maybe add that the kinds of evaluations that we would do for school-aged children versus younger children are different, and we have to acknowledge that we shouldn't be looking for changes in outcomes like stunting among school-aged children, because the vulnerability to stunting is for a much earlier age group. So things like that are important, that when we do embark on evaluations, that we pick the right outcome indicators for the programs. And also to be realistic about what we think we can achieve within a certain time period. I think that's quite important, that we don't, some of these problems are really sticky. They're called wicked problems, which means that there are so many different factors at play that it's very difficult to kind of untangle them. And so we should have realistic expectations, but it is really great to hear the Department of Education talk about their responsibility towards nutrition following the function shift, and we're very excited to keep the conversation going. I think it's really great to keep in mind that the full essential package of ECD services in the National Integrated ECD policy includes nutrition, and therefore always when we talk ECD, we should be looking for all 5 elements of that package, not just early learning, but also to understand how the different parts of the package influence each other, and that it's not just one thing, it's a lot of things, and children should have access adequate quality access to all 5 parts of the essential package. That's the goal that we're all working towards.
Thank you. Neo, do you want to anything from your side?
Oh, yes. I don't think I have much to say, but to acknowledge the fact that, yes, the differentiation will come in there. In fact, I'm already seeing a pattern where, or rather a vision where we're going to have separate, cohorts of evaluation questions, perhaps if we have to begin to extend the program to ECD centers. And that, of course, the data would be helpful towards us, even redesigning the program to fit within that cohort. I mean, the first 1,000 years, of course, it's an area that the Department of Health has not been involved in, but we are happy to say that we have the DSD capacity coming over. I have heard in recent meetings as we engage with the Department of Social Development that we will absorb those that have been involved before. So that would mean that it will just be a transfer of skills and the sharing of knowledge and data that is available. So we will actually be just continuing with the program and learning as we go along in terms of making sure that the nutrition aspect is also strengthened. Mm-hmm. And yes, nutrition, I wanted to say the work streams. We actually have 7 work streams, and health and nutrition is part of the work streams that have been looking at, much more detail, because then those task teams, or rather the officials that are within those work streams, were looking at the detail and were looking at the data, looking at what needs to be done, and be able to make recommendations moving forward. So I do agree with Anna Marie that nutrition is part of, it's one critical aspect in terms of the ECD cohort. Thank you.
Great, thank you. In the chat box, with the resources both for more information around the school nutrition program as well as for the evaluation are posted in there. So I'm not going to take some of the questions that are directly related to that, because what we're really trying to explore in these last sort of 10, 15 minutes is around the integration of nutrition into schools programs, but also in terms of the monitoring and evaluation practice. And so for sort of reflecting on the learnings and what people are taking out of this COP, it would be really interesting to hear from people, and in the chat box around, how is nutrition being integrated into the school programs, and what is being done in terms of the monitoring and evaluation, or what could be done, but also maybe if you've got specific questions related to that, that we could also post and get some reflection and some input from everyone that is on this on the call. We were going to share with you a theory of change and have a discussion on that, but unfortunately, time is of essence here. Benita, I don't know if throwing you sort of in the deep end, if you want to just talk, just sort of mention around the theory of change, but also sort of reflect on what has been discussed here, from a point of view of an evaluator as well. You're on mute.
Hi, Margie, thank you for that. So just in the chat box, I've posted a link to a theory of change that looks, it's a very complicated thing, but I really love this document. It's quite old. It's a 2012 example of a theory of change for scaling up integrated nutrition practices. I think it's quite interesting to look at this because it talks about integration, right? Across different components, across the typical agriculture, health, education sectors. The integration is quite important. I think the other focus that's quite interesting here is that it talks about scaling. So it's good that we talk about local interventions, but it's also important that we look at programs that can be scaled out, like the National Nutrition Program, and how we can extend it to meet the needs. The other thing that's really interesting about this document, you can see that there's 3 diagrams. And if you're an evaluation practitioner, you probably have drawn a theory of change diagram. But this is a really good example of how you can draw 3 examples, 3 ways, the theory of change. So have a look at that when you have a moment. And I think it's just important that we look at the integration of the projects that we are busy with.
Great, thank you. Okay, just opening now the chat box. Okay, I think that let's just look at some of these. Just a reminder, yes, recordings and presentations will be shared. I can see Gary C. Would you like to come in here?
Hi, everyone, and good morning. So I'm from the Fuel Trust and have been part of the team that's partnered with NAO and the whole of the Department of Education. You know, having spent 15 years working with the system to try and get it monitored and evaluated properly so that good decisions can get made, I think there are some learnings to try and take to ECD, if I may. You know, I've had the benefit of working with, call it KYB and Smart Start and the city of Joburg in terms of trying to get, you know, call it affordable nutrition to children. I'm not an expert on, call it, the first 24 months, so I'm not going to pretend that I am. But I mean, my advice is, if we really want to change the way young children, call it 2 to 4 or 5-year-olds, are fed, we need to accept that if we serve them, call it a nutritious meal or meals, then it will have the impacts that we think it is. I mean, there's enough research out there. We stopped asking ourselves, does school feeding work? Because we know it works, and there's enough international research out there saying that it does work. Obviously, you've got to do it properly, and as Nao said, obviously you've got to try and make it as nutritious as possible, or your bang for buck. I mean, they've only got 3 Rand per learner to do that. And so, you know, to me in ECD, the Department of Health have set out some norms around what learners should get in terms of breakfast and snacks and the main meal. And I think that we should be trying to focus on simplifying that for ECD practitioners, whether they are a young woman looking after 6 children in a shack, or a center looking after 30 or 40 people. And I think we need to back ourselves that if we can give children with the best bang for buck this money, it's going to tick the outcomes we want, rather than trying to evaluate. It doesn't mean we should monitor and track growth and things, but and it's complicated, and in some ways the biggest challenge is money, because sites, the ECD sector needs the funding. I also think that in the transition from where ECD is now to DBE, I think that all stakeholders need to understand how different the systems are. In the schooling system, every school has an EMIS number. Everybody knows the schools belong to the government, and they are run by officials in the system, and it's all funded through a conditional grant, and there's policy. Whereas in ECD, you've got the Department of Health, you've got local government, you've got social development, you've got different people monitoring and funding it. And I think that, and at the end of the day, it's a private system. because it's run by private individuals. And I think if we can get our heads around that, it'll be easier to bring the transition into the Department of Education outside of, call it just a grade R classroom at a school, because it's much bigger than that. So I guess my summary would be, let's try and simplify, you know, and I've tried to take my learnings from primary schools in the nutrition program and apply it to 3- and 4-year-olds and say, well, for 2 Rand or 3 Rand or whatever, if we give them this, then they will learn, then they will arrive, and they will grow. And it doesn't mean it's going to fix every micronutrient deficiency or stop stunting, but I just kind of think we need to get going. Anyway, let me stop there.
Thank you very much. I think those insights are really important, and definitely in terms of sort of sharing learnings and looking at what needs to adapt, what can be taken forward, what can be, you know, what can be used. And I think there was a comment in here, and it was touched on right at the beginning around, and in the first presentations, around what are the tools or mechanisms or sort of easy ways of being able to get this going, as you say, Gary, in the ECD sector. So I think it's from both, the practitioner side of it and the people who are involved in the programs, and then there's definitely also the role in terms of government. And I think what this platform and this community of practice is really showing, is try to explore, is this nexus and the relationship and the engagement between the actors and the stakeholders. And I think that's been a really important part of this community practice, as well as bringing in the data part of it, the evidence base of it, but really importantly is around actually using these results. And I think that's come through from both the presentations. And I think that's also really something for evaluators, is around, we often produce the recommendations based on the evidence. And what's really encouraging is seeing it when the users of these evaluations do take it forward into implementation plans, into recommendations, and actually following these through, so that we as evaluators can also then see over time that the recommendations that have been made are also right, that they are solid in terms of taking it forward. So I know we haven't addressed all the questions and the comments that are in the chat, but we are running out of time. So I just want to do it so that we can, wrap up at 12, but then do stay on to address any of the questions and respond to anything further in the chat. But a huge thank you to our presenters, to everyone who has shared and participated in this community of practice. We've got two announcements. So firstly, Benita, would you come in? I did forget to say right at the beginning that the Bridge Community of Practices are supported by SIMEA, our South African Monitoring and Evaluation Association, by Kulisa, which is where I am from, and also from Chikalula. And I know, so Benita is here now putting on her hat in terms of SIMEA. Please, will you share your announcement?
Yes, Margie, so quickly for you, for anybody that's not aware, the South African Monitoring and Evaluation Association is the home for people interested in monitoring and evaluation. You join for, I think it's a fee for 400 Rand, but you can even get news if you don't join, right? So you just need to register an account on the website. You get all kinds of benefits. It's on the screen. Most recently, well, it's actually concluding tomorrow. They did a hackathon instead of an annual conference. Because of COVID, we couldn't have a conference. But what they did is they came up with a really innovative and lovely way of trying to build capacity. And that's a hackathon where they got evaluators and anybody interested working together on things like producing an evidence gap map. I'm really excited about the guideline and definition of equity, environmental sustainability criteria. So this is the type of thing that SIMEA does. It's really important work that SEMIA is doing in the continent and in evaluation globally. So please do join. Like I say, you can just join on the listserv if you register an account on the website, but you can also join up as a member, pay your membership dues, and then you could get all kinds of discounts. So that's it.
Great, thank you very much. So the next Monitoring the Evaluation Community of Practice is going to be on the 24th of November, and this is actually going to be a national one. So it's going to be a super M&E CoP. It's going to involve the bridge M&E CoPs that are Cape Town, Johannesburg, as well as the various SEMIA chapters. So please put that in your diary for the morning of the 24th of November. Bridge will be sending out some further information on that. It will be partly a reflection one also around what has been happening over the last 2 years, given the changes that we've all had to adapt to, including the monitoring and evaluation sector in terms of COVID. And, you know, what are the changing then competencies of evaluators and bit of, you know, forward thinking in terms of where are we going in the sector. So we're really looking forward to that. Thank you also to everyone who has been tweeting about this monitoring and evaluation CoP. Really, I think it's been really stimulating. I think it's a conversation that needs to continue between all of us. So this has sort of just been a point at which we're starting to connect and to engage further on it. So huge thank you to everyone. I'm going to stop facilitating now, but please do continue to just comment in the chat box, and remember that the highlights, presentations, etc. will be circulated and available on the Bridge website. Thank you so much, everyone. Have a wonderful day. Keep well, keep safe.
Thank you. Bye.